Welcome, my dear audience and friends, to another monthly episode of Cancer Convos with Grace B. This is your host, Grace B, coming to you from New York City, the city that never sleeps and is home to Cancer Convos with Grace B. I'd like to thank you all ever so much for continuing your wonderful support in seeing that this show stays on. And before I go on, I'd like to say happy Thanksgiving, everyone, and may all our dreams come true. So, in this monthly episode, I have my esteemed guest who is doing phenomenal work in an amazing community that you'll be getting to know more about. Our focus today is when a parent has cancer, taking care of children and teens. And so, without much ado, I'd like to welcome Migdalia Torres, who is the Executive Director Programs at the Red Door Community. Welcome, Migdalia, and so wonderful to have you here with us. Thank you for coming.
Hi, Grace. Thank you for inviting me and bringing attention to this very relevant topic.
You're welcome. So please, could you tell us about yourself?
Yeah. I'm an oncology clinical social worker, and I have dedicated the last 28 years to understanding and supporting the psychosocial needs of cancer patients and their families.
Wonderful. Do you have a personal cancer story to tell?
I do. I was diagnosed in 1991 with ovarian cancer. And so I have a personal understanding of the emotional and physical challenges that cancer presents. However, it's at Red Door Community that I have truly learned the powerful impact of community support.
Absolutely. There's nothing like community support. I can
Mhm,
tell you
mhm.
that. It's like, a buttress for everything that we go through. Yes.
I agree.
So, as regards, I'm sure you know a bit about me that I'm a breast cancer survivor,
Mhm.
late stage. And this topic is really appeals to me and to so many others because when I had to give my daughter that news, I mean, it like,
Yeah.
brought out the whole world tumbling down.
Mhm.
So, as a licensed social worker, how would you speak to younger children and teens about cancer, please?
I think it's the basic understanding that being a child when a cancer is in the family can be very scary. It can be
Mhm.
isolating and very confusing. So being very clear, simple, open, and honest communication with your child or teen is critical here. And it's also can be very scary and intimidating to have these conversations. So first, it's important to check in with how comfortable you are having this conversation with your child or your teen. And part of the difficulty for parents, as you probably can identify with, is that sharing this information with your children really requires you to have a true acceptance of the fact that this is happening, right? And it's a parent's propensity to want to protect their child and their teen. So providing this kind of information sort of is counterintuitive. You want to do everything to protect it, and here you're delivering some information and update that can create all of these emotions. And so you have to really sort of do a check-in with self so you can have very clear, simple, and open and honest communication with your child. And so it's important to also, when you have this conversation, depending on the age of the child, to really, speak with them in age appropriate language.
Mhm.
It's important to encourage them to ask questions. You can reassure them that even if they don't have questions at that moment for you, that you're always available to talk at a later time. With younger children, it can be very helpful to give basic information and offer it in smaller doses. If it feels they are having a hard time understanding or having a lot of emotions, I
Mhm.
think it's especially helpful to ask what they know and understand firsthand. You can learn a lot from what they share, and it helps for you to know how to start the conversation based on what they already have an understanding regarding cancer. For example, do they have a misunderstanding or assumption about cancer? What
Mhm.
do they already know about it? What have they observed? What have they heard? Validate and allow expressions of all feelings. Some children and teens may feel sad, angry, worried, and anxious, or they may not seem to have a response at all. It may be important for them to balance stronger emotions with breaks in which they can act happy and like nothing has changed.
Mhm.
This doesn't mean that they're not processing it or they're not living in reality. I think sometimes parents, say, but it doesn't look, they're not acting like anything is wrong. They may not be presenting those emotions, but they may be processing those emotions. It's also okay to not know everything or how to respond to each of their questions. You can validate the question and let them know you don't have the answer yet. Also reassure them that they can find out the answers, together with you.
Mhm.
Um, you can even ask your child or teen about how they want to receive information about your cancer diagnosis. Some kids who are a little bit older just, want to get communication via emails, right? They say, just email me updates. With technology today, there's many ways of communicating with your children and your teens, but it's important to know how they want this information delivered, because I think that'll make it much more digestible for them.
Absolutely. Yes, that's so true. And you hit on a very good point there. Talking about children who are probably very silent, but they're still, we shouldn't think that they don't care, whatever. They're probably just trying to process the information given them. But you find quite a lot of teens. I have like two or three at my fingertips whose parents were diagnosed, who kind of closed up, went into their shell. H- what are the processes? How do you try to lure them out to make them more open to conversations?
Well, I think it's important to be patient. It may take months before a child wishes to talk about the illness, right? And I
Mhm.
think it's important to model as a parent, show how you express and share your own feelings. Your
Mhm.
teen may be looking to you on how to react and how to respond. If you share some of your feelings, they may in time feel more comfortable sharing theirs with you. I think it's also important to share this information with your teen's school. They can be very helpful also in providing extra support as well. So I think it's important to, understand that children, especially teens, where they're trying to gain their independence,
Mhm.
have one foot in and one foot out. So this is a very delicate developmental stage, for teenagers, and you throw in a crisis so that, sort of takes them on a bit of a spin, right? So I think it's important to be patient and to try and help them create balance as much as possible. So, try and, encourage them to maintain routines and maintain, tradition and activities, with acknowledging that something has changed at the same time and that there's going to be a range of emotions as well.
Absolutely. You've, hit the nail on the head.
Mhm,
That is very important. And I think sometimes parents too have to go through certain programs to actually be able to live this kind of information that you're sharing, because
mhm,
as a parent or guardian, you're caught up in so many things that you're trying to get well, and of course you have a dual responsibility of staying alive and trying to make sure that your children are not caught up in the whole
mhm.
brouhaha, so to speak.
Yeah.
So this is something that the parents and guardians too should be able to, should I say, get some training or get some kind of way to be able to manage their crisis with their children.
Yeah, it's sort of, becoming educated, really.
Yes, yes, absolutely. Thank
Mhm.
you so much for that. Migdalia, you're doing so wonderfully, and especially Red Door has been around for, decades. I still remember watching Gilder as a comedian years ago, and the magnanimous work that Gilda's Club and now Red Door Community has, it's morphed into something fantastic. As director, ED of program, what is, for those that do not know much about Red Door Community or at all, what is the
Mhm.
mission and vision of Red Door Community, please?
Yeah, so Red Door Community's mission is to provide welcome communities to anyone and everyone who's impacted by cancer. So we provide free cancer support to bring knowledge, hope, and empowerment to anyone and everyone impacted by cancer and their families. We really are committed to expanding our program, broadening our reach to meet the growing needs of individuals who are living with cancer in more places and in more ways than ever, especially now that we are 100% virtual. And as executive program director, I oversee the day-to-day operations of Red Door Community's comprehensive psychosocial support program. Our program is for cancer patients, their caregivers, and families during treatment, post-treatment, and for those who are grieving the death of a loved one due to cancer. We provide weekly and monthly support groups, individual counseling sessions, healthy lifestyle workshops. And our workshops, really touch upon three areas: stress reduction, body movement, and creative expression. We also have educational lectures. We bring experts to discuss and share information that's very relevant to the community. And we also offer social activities, to build that sense of community, which is really the core of our program: community, community, community. Our youth program mirrors our adult program, and it's offered to children ages 5 to 12
Okay.
and teens ages 13 to 17.
So, these children, are they ones that have been diagnosed with cancer, or their parents or guardians have been?
So, all of the children who come to our program are impacted by cancer through a loved one. They're either living with a parent who's been diagnosed with cancer or are grieving the death of a parent due to cancer.
Oh, wonderful. Yes, that's good. So, how is the community, aside that, spearheading, children's empowerment? What comes after? Okay, probably the parent or guardian has passed on. What next steps do you take to cushion the effect of the emotions of that child?
When our children come to us, either as, living with a parent and transition sometimes to our bereavement program, or they come in already grieving the death of a parent. And so, what we, try to support it is understanding that the grieving process is a really normal and very appropriate response to the loss of a primary loved one, in this case, the death of a parent. And so we provide individual counseling. So the first thing we provide is, 6 to 12 individual counseling sessions for our children who are going from our living with a parent and then transitioning to our bereavement program. We offer them 6 to 12 individual counseling sessions to bridge that transition. And then we transition them into a bereavement group where other children are also grieving the death of a parent. And in that program, they start to learn and to identify what they're experiencing, what they miss the most, what are they scared about the most. And, we try and help them feel safe in expressing the range of emotions that they have, that this is a safe place, that they can do this, and that they're not alone. They're not the only ones. I think it's important for children to feel that they have a community of support, that when they go to school they may be the only one, but when they come to Red Door they're one among many, right? And so that it helps normalize the experience. As painful as the experience is, it helps to normalize it.
Absolutely. That's wonderful. So in other words, that trying to let them know that there is life after a diagnosis or after a death and
Mhm,
whatever. And the good thing about I think is for them not to feel alone and the,
mhm.
sense of, comfort and support that you give them. That's very crucial because
Absolutely.
this is an experience that will live with them for life. And
Mhm,
they
mhm,
should be able to know how to deal with this aside other life experiences that they will have to pass through.
mhm, mhm,
That's wonderful. So, for our audience who would like to, connect with you, who
mhm.
feel that they would need to come and see what, you know, Red Door is an open house,
Yes.
how can they reach you, please?
Yeah, so for information regarding membership, you can go to our website,
Mhm.
reddoorcommunity.org, and you can complete a membership information request form. And it's a very simple, 4-point questions. And then you will
Okay.
get a call from one of our program staff members to coordinate a one-on-one meeting with one of our mental health professionals.
All right. So it's listeners, viewers, it's going to the Red Door community website where you'll see all the information. If you
Mhm,
want to be a member or if you want to
mhm,
share with someone who would like to be a member, all that
mhm.
information will be available there.
Mhm. And
Thank
also you can always, Grace, they can always call 212-647-9700.
Okay. Thank you for that. I'll put it in my show notes. So
Sure.
all the links and everything will be in
Mhm.
my show notes. So they'll be
Absolutely.
able to reach out to you.
Mhm.
Thank you so much for doing this, Migdalia. So before I allow you go, because I know, hectic schedule, what is one fun thing about you and how do you unwind?
Um, so I love walking. So, I distress
Nice.
by taking my 10-mile walk every weekend.
Wow.
And I love watching mystery movies. I just gobble them
Oh,
up.
just like me. Yes.
I love solving the mystery before the end of the
I
movie.
know. Drives everybody wild in my house. Let the
Absolutely.
movie end. Oh, that's wonderful. Yeah. So you have your thinking cap up there as always,
Yeah. Yes,
problem solving. That's
that's right.
wonderful. Thank you ever so much, Migdalia, for coming. You don't know how appreciative we are having you and finding the time to come and share your expertise on how to deal with children and teens when their
Mhm.
parents or guardians have been diagnosed with cancer. We appreciate you and hope to bring you back some other time.
Thank
Thank you
you,
so
Grace.
much. Before I let you go, let me wind down. So, my dear audience and friends, there you have it. You've been listening to the beautiful Migdalia Torres, who has been sharing her expertise about how to take care of our children when we have been diagnosed with cancer. I shall be putting all the necessary information in my show notes on my YouTube channel. And before I go, I wish you once again a happy Thanksgiving and stay safe. God bless you. Bye bye now. Thank you, Migdalia. See you again. Bye bye.